My name is Sean Kings. I'm Canadian and I'm a fourth-year medical student at AUA. I'm a father of two. I'm doing my clerkships at Richmond University Medical Center right now. I finished psychiatry, obstetrics and gynecology, and I'm starting pediatrics next week. My wife and I really looked into it thoroughly and we found AUA to be the best fit. They had a very well-established school. They were building new campuses, and Antigua was an island that had a lot of amenities that could help us live comfortably. When I applied to AUA, one of the critical components for me was the fact that the MCAT didn't play a key role in my acceptance. Really, it had been my experience working with patients that there were a lot of things that a standardized test doesn't tell you about how good a doctor you're going to be. In fact, I've been able to score in the top percentile in all of my exams, especially the Step 1 exam and the Canadian board exams, and that's going to open doors for me. It's going to allow me to apply to residencies that are going to help me fulfill my dream, and I'm really grateful for the work that they made me do and the standards that they set for me. After I finished my 2 years in Antigua doing my academic work, I had to take some time off because we had our son, Kieran, who was born. I didn't know whether I was going to be able to finish my rotations because the challenge of traveling different states and different hospitals with a family is formidable. And I was very lucky. I had done very well in my exams and very well in school, and the clinical department really bent over backwards to help me secure rotations that would allow me to travel back and forth, and made sure I had letters for immigration, and that everything really ran very smoothly. And it's a dream come true. I wouldn't have been able to do it without their help. I'm usually up at 5, and then I'm in the hospital by 5:40, and we round on the patients. The residents and the students do morning report by 6:30. You go and you really handle that whatever walks through the door. You're going to be triaging patients. You're going to be, as a student, you're really trying to help the residents stay up because they have a lot to deal with. And your job is to really make sure that if there's any little details that they need or vital things that they need, that you're there to help them. And in return, they usually help you by teaching you. Our day usually ends around 3, 4 o'clock, depending on what's going on the floor. And we do sign out with the residents, and then depending on if you're on call or not, you may be there till 6 a.m. the next morning. The biggest thing to know if you're going to apply to medical school and AUA is that they're going to be demanding on your time. You have to expect that you're going to be in class, that you're going to be studying, and they expect commitment from you. There's a real maturity that seems to take place when you finally realize that you're about to become a doctor and you're training for something that's going to be impacting people's lives every day.